Why are people with high blood pressure at greater risk for dangerous complications? Introduction to hypertension and its risks. Hypertension, or high blood pressure, is a chronic medical condition in which the force of blood against the walls of the arteries is persistently elevated. This condition affects millions of people worldwide, making it one of the most prevalent health issues globally. While high blood pressure may seem harmless at first, especially since it often presents no obvious symptoms, it poses significant long-term health risks if left untreated. One of the most concerning aspects of hypertension is that it increases the likelihood of developing severe and potentially life-threatening complications. But why are individuals with hypertension more susceptible to dangerous complications? To answer this, we need to delve into the physiological effects of high blood pressure on the body and understand how it can lead to damage across various systems, especially when left unmanaged. Understanding blood pressure and the cardiovascular system. Blood pressure is the measurement of the force exerted by circulating blood on the walls of the arteries as the heart pumps blood through the body. It is typically recorded as two numbers: systolic pressure, the pressure when the heart beats, and diastolic pressure, the pressure when the heart rests between beats. Normal blood pressure is generally considered to be around 120/80ths of a millimeter of mercury. Hypertension is diagnosed when a person's blood pressure consistently exceeds 130/80ths of a millimeter of mercury. The cardiovascular system is designed to handle normal blood pressure levels. When blood pressure rises, the force exerted on the blood vessels increases, causing them to work harder than they should. Over time, this added strain can cause damage to the arteries and organs that rely on efficient blood flow, such as the heart, kidneys, and brain. The continuous high pressure weakens blood vessels, accelerates atherosclerosis, hardening of the arteries, and makes individuals more susceptible to a range of health issues. Hypertension and arterial damage. One of the most immediate and severe effects of hypertension is the damage it inflicts on the arteries. Arteries are blood vessels responsible for carrying oxygenated blood from the heart to the rest of the body. In a healthy person, the arteries are flexible, elastic, and able to handle the regular flow of blood. However, when blood pressure is consistently high, it can lead to several adverse effects on the arterial walls. Thickening and narrowing of arteries. The consistent pressure exerted on the arteries forces them to become thicker and stiffer, a condition known as arteriosclerosis. This process occurs as the body tries to strengthen the arterial walls to withstand the increased force of blood flow. While this may seem like a protective response, it actually leads to a decrease in the flexibility of the arteries, making it harder for blood to flow through them efficiently. Narrowed arteries are more likely to become clogged with fatty deposits, plaque, which further restricts blood flow and increases the risk of serious complications such as heart attacks and strokes. Atherosclerosis. Atherosclerosis is the buildup of plaque, a mixture of fat, cholesterol, and other substances, in the arteries. High blood pressure accelerates the development of atherosclerosis by causing micro tears in the arterial walls, where plaque can more easily accumulate. Over time, the plaque hardens and narrows the arteries, reducing blood flow to critical organs. If a blood clot forms in an artery that is already narrowed by plaque, it can completely block the flow of blood, leading to a heart attack or stroke. Hypertension's impact on the heart. The heart is perhaps the organ most affected by high blood pressure. The primary function of the heart is to pump blood throughout the body, ensuring that all tissues receive adequate oxygen and nutrients. However, when blood pressure is high, the heart must work harder to pump blood against the increased resistance in the arteries. Left ventricular hypertrophy, LVH. One of the most common consequences of long-term hypertension is left ventricular hypertrophy. The left ventricle is the chamber of the heart responsible for pumping oxygenated blood to the body. When blood pressure is elevated, the left ventricle must exert more force to pump blood, causing the muscle to thicken and enlarge. While this thickening initially helps the heart cope with the increased workload, it eventually leads to reduced heart efficiency. Over time, LVH can progress to heart failure, a condition in which the heart is unable to pump enough blood to meet the body's needs. Heart failure. Hypertension is a leading cause of heart failure. When the heart is forced to work harder due to high blood pressure, it can become overworked and weakened. This leads to a condition known as heart failure, in which the heart cannot pump blood effectively. Heart failure is a serious condition that can cause shortness of breath, fatigue, and swelling in the legs and ankles. It can also lead to fluid buildup in the lungs, pulmonary edema, making it difficult for a person to breathe. Coronary artery disease, CAD, as mentioned earlier, high blood pressure contributes to the development of atherosclerosis. When the coronary arteries, the arteries that supply blood to the heart muscle, are affected by plaque buildup, it can lead to coronary artery disease, CAD. CAD is the most common type of heart disease and a major cause of heart attacks. When the coronary arteries are narrowed or blocked, the heart muscle may not receive enough oxygen, leading to chest pain, angina, or, in severe cases, a heart attack. Hypertension's effect on the brain. The brain is another critical organ that can be severely affected by high blood pressure. The brain requires a constant supply of oxygen and nutrients to function properly, and this is delivered through the blood vessels. Hypertension can cause both short-term and long-term damage to the blood vessels in the brain, leading to several serious complications. Stroke. One of the most dangerous complications of high blood pressure is stroke. A stroke occurs when the blood supply to the brain is interrupted, depriving brain cells of oxygen. There are two main types of stroke, ischemic and hemorrhagic. An ischemic stroke is caused by a blockage in a blood vessel, often due to a blood clot or atherosclerosis. A hemorrhagic stroke, on the other hand, occurs when a blood vessel in the brain bursts, leading to bleeding in or around the brain. Hypertension is a major risk factor for both types of stroke because it weakens blood vessels and increases the likelihood of blockages and ruptures. Cognitive decline and dementia. Long-term hypertension has also been linked to cognitive decline and an increased risk of dementia. This is because high blood pressure can damage the small blood vessels in the brain, leading to a condition known as small vessel disease. Small vessel disease reduces blood flow to the brain, which can cause damage to brain tissue over time. This damage may result in memory problems, difficulty concentrating, and other cognitive impairments. In severe cases, it can lead to vascular dementia, a type of dementia caused by reduced blood flow to the brain. Kidney damage due to hypertension. The kidneys play a vital role in filtering waste and excess fluids from the blood. Healthy blood pressure is essential for the kidneys to function properly, as they rely on a steady flow of blood to perform their filtration tasks. However, high blood pressure can damage the blood vessels in the kidneys, leading to kidney disease or even kidney failure. Chronic kidney disease, CKD, hypertension is a leading cause of chronic kidney disease. When blood pressure is consistently high, the blood vessels in the kidneys become damaged, reducing their ability to filter waste from the blood. As a result, waste products and excess fluids begin to accumulate in the body, leading to further complications. If left untreated, CKD can progress to kidney failure, a life-threatening condition that requires dialysis or a kidney transplant. Kidney failure. In severe cases of hypertension, the damage to the kidneys can become so extensive that they lose their ability to function altogether. This is known as kidney failure or end-stage renal disease, ESRD. Individuals with kidney failure require dialysis, a procedure that removes waste from the blood, or a kidney transplant to survive. Hypertension is a significant risk factor for kidney failure, particularly in individuals who have other conditions such as diabetes. Hypertension and vision problems. High blood pressure can also affect the blood vessels in the eyes, leading to a condition known as hypertensive retinopathy. The eyes contain delicate blood vessels that are susceptible to damage from elevated blood pressure. Over time, this damage can lead to a range of vision problems. Hypertensive retinopathy. Hypertensive retinopathy occurs when the blood vessels in the retina, the light-sensitive tissue at the back of the eye, become damaged due to high blood pressure. This can cause vision problems, including blurred vision, double vision, and even vision loss in severe cases. The severity of hypertensive retinopathy is often directly related to the severity and duration of hypertension. Individuals with poorly controlled high blood pressure are at greater risk of developing this condition. Eye stroke. Similar to a stroke in the brain, an eye stroke occurs when the blood supply to the retina is blocked. This can lead to sudden vision loss, which may be temporary or permanent depending on the extent of the damage. High blood pressure is a significant risk factor for eye strokes, as it increases the likelihood of blood vessel blockages in the eyes. Conclusion. In conclusion, individuals with high blood pressure are at greater risk for dangerous complications because hypertension affects multiple systems in the body. The cardiovascular system, brain, kidneys, and eyes are all vulnerable to the damaging effects of elevated blood pressure. Over time, these effects can lead to serious and potentially life-threatening conditions such as heart disease, stroke, kidney failure, and vision loss. This is why it is crucial for individuals with hypertension to manage their condition through lifestyle changes, medications, and regular medical checkups to reduce the risk of complications and maintain overall health.